On TikTok, every skincare hack looks like magic, fast, flawless, and foolproof. But is it really skin science or just smoke and mirrors? We're putting the biggest viral trends under the microscope and giving them a thumbs up or a hard pass and explaining what's really happening beneath the skin.
Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Roston, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started.
All right, Dr. Roston, I know how much you love social media.
I'm addicted.
So I'm really excited today to go into some of these viral trends that patients ask us about. And let's just go ahead and get started. Have you heard of the salmon sperm facial? And what do you think?
Well, let's clear one thing up. She's being facetious when she says she knows how much I love social media, but she's absolutely right. I get mesmerized by these things I see about skincare and so-called experts. The truth is my Instagram is all horses, but I do see these things, or the staff shows me. So salmon sperm facial, the short answer is no. I've never heard of it except kind of peripherally. I mean, I read the Wall Street Journal, not Vogue. But I was introduced to it in preparation for this podcast and learning about it. And it turns out it comes from salmon sperm. Another trend was trout sperm, and they contain polydeoxyribonucleotides in the sperm. They're small fragments of DNA and activates a complex signaling mechanism, apparently, that's supposed to generate renewal, rejuvenation, cell growth, that kind of thing. So I looked into it. Mm-hmm. You'll be not surprised to know there's really no studies in humans.
Would you feel better about it if it was horse sperm?
No, I wouldn't. That sounds gross too. But none of it sounds gross. What it is what I really like is tapping into the potential for regenerative medicine. But if you dial down into it, we don't know a whole lot about this one. It might be in 2, 3, 5 years, this is all the rage. There's salmon farms, and we got all kinds of sperm and healthy omega-3s from the salmon. But right now, it's just unknown. I mean, what do you think, Dr. Mc? Could it be harmful?
I think it could be. You have to really know where you're getting your raw goods, right?
Absolutely.
Mean, the big question I have is, how are these farms regulated? How is the sperm processed? Are we making sure we're not putting something that's potentially infectious on our skin? And I've heard of people using the salmon sperm facials, which, I think that's one thing. I've also heard of people actually injecting it as a filler.
Oops.
Which that's
bad idea.
Yeah, I'm not a big fan of that at this point in time.
Bad idea.
But I do think, like you said, regenerative medicine is a new frontier for dermatology. There's a lot of exciting research. So maybe as we learn more and these manufacturing processes become more standard and maybe even FDA approved, then maybe we'll feel differently in a few years. But for now, do you give it a thumbs up, thumbs down? What do you think?
I'm going to give it an iffy. I don't think it'll hurt you, but in terms of efficacy, do I recommend it? It is a thumbs down, but are you hurting yourself? That's the big unknown. You might just be having sperm byproduct put on your face and none of that active ingredient, the polydeoxyribonucleotide, which is what you're paying the big bucks for. Mm-hmm. No testing on this. So what is your opinion on it? Thumbs up or thumbs down, Dr. McLean?
I think for now it's a thumbs down, but like I said, who knows what the future holds? And I know some people are even traveling to Korea to have some of these procedures done where maybe they're a little bit further ahead. So here it's not FDA approved. I would not recommend. But in some areas, maybe it's exciting for the future.
I think it's exciting for the future.
Yes. What else did you want to talk about? What have you seen besides horses on your social media?
Horse show jumping?
Okay.
No, but I am informed, and
Yep.
I have been told. All the nurses were talking about this wearing a bandage on your face, and I couldn't help it. So what is that?
Is
I
that the
asked.
mouth taping?
No, yes, this was actually an elastic bandage. It turns
yes,
out,
yes,
but
yes. Yep.
so I looked into that. Well, actually, my initial response is, well, we have those in the clinic. We use them after chin liposuction as a compression garment, and these look just like it. The facelift surgeons will be familiar with this. They get a garment after a facelift. Oh, but apparently if you rename it and you're a Kardashian, you can claim anti-aging benefits.
I think that's what they're calling snatched. They're trying
The
to get that
snatched
snatched jawline. I think, if anything, temporary benefit with that. I would not waste your time, and it also seems incredibly uncomfortable.
Right. There's no way that's going to sustain yourself beyond more than 10 minutes of taking it off. Ask anyone who's had surgery on their chin. I say, well, look, you can take a break from your garment to go to the grocery store, and they feel fine initially, and then they come back after 15 minutes. They're like, oh, my God, I want this thing back on. It is not a sustainable benefit. No, it is used for lymphedema on the arms, but again, ask a lymphedema patient. As soon as she takes it off, she's in discomfort. No sustainable benefit.
And same thing when we do procedures for varicose veins and
Absolutely.
they have to wear the compression hose. I'm sure you hear complaints about how uncomfortable those are all the time, but
They're very healthy.
they are helping for the legs. But
So you can spend your money in better places, I think. Also, you can go to bed looking better and spare your hair. Can you imagine what your hair looks like in the morning after wearing this garment?
sounds like a recipe for traction alopecia.
Oh, it can be. That is absolutely right. Some people are more prone to traction alopecia than others. All valid points. I'm going to give it a thumbs down.
Same. Thumbs down.
Thumbs down.
Yes.
Wear your support hose on your knees, though.
Yeah. All right. And next up,
Oh, yeah. Here we
wash-shaw.
go. Wash off.
Facial
Face
rolling.
Face rolling. Well,
Let's demonstrate.
Well, I asked, and it turns out one of our staff, she goes, oh, yeah, I keep it in my freezer, and I use it every morning while I make my coffee. This is a massive face roller. If you had an intruder at night and it was at your bedside table, you might be able to just give him a
I do love a
hook with it.
multi-use product.
I've not seen one like this. I do have one. I have a small marble roller, and in fact, I sent a patient to the store because we don't have them here to buy one because she collects fluid in under eye bags, and I've told her you don't even have to keep it cool. The stone or the marble, the ceramic is cold, but you can keep it in a freezer or refrigerator and roll to the outside, mimicking lymphatic flow. And I think the eye is an area where it actually works. I guess if you wake up puffy, a cool roller will definitely help you. Some people talk about using the little roller to help your products get in. I'm sometimes compelled with that, but at this age, I put so many products on, if I stopped to roller each one in, I'd be an hour late to work. But it can be helpful around the eye area. I'm curious, have you tried one, Dr. McLean?
I haven't.
She's too young.
Well, I do get puffy sometimes, but I am in a busy phase of life. I mean,
Right.
I work here. I feel like when I'm at home, I hardly have time to wash my face some days. So I haven't introduced it into my routine, although I do think that, having that as part of your routine while you're waiting on your coffee to brew doesn't sound like a bad idea.
It does not. I
Yeah.
don't think this is something that will cause any harm. I'm not sure you'll see a huge benefit. And even without the roller, if I have puffy eyes, you can actually just kind of milk with your finger, getting that fluid down where it needs to go. But this is a fancy little trend. One test for me is, would I travel with it? That's a firm no. If I make a product recommendation for you and I say, I travel with this thing, you can make sure I mean business with that.
That's a good, I think, yardstick for how much you value something.
So maybe we should put some parameters on our thumbs up, thumbs down. For anti-aging, I'm going to give it a thumbs down for anti-aging. You?
For long-term anti-aging benefits, thumbs down. But, if you wake up puffy, maybe you've been traveling, eating a lot of salt, maybe you had too many drinks the night before, It might help make you just feel and look a little bit better short term. Why
So
not?
thumbs up, short-term benefit, feel good, decrease puffiness, try a roller, big size or micro size.
Have you heard of caveman skin?
I have.
Yes.
And that's just going natural, right?
Yes, I think
Living
it's,
under a rock or inside a rock, a cave,
yes. So I think this
along
is
the Appalachian Trail.
the less is more trend, just amplified. So this is basically people who advocate doing absolutely nothing to your skin, including washing it. I think it's just retention hyperkeratosis rebranded.
Yes. Skin buildup. I mean, why would you want to return to the pioneer days where you have to go and beg for your water out of a well and carefully take a teaspoon out to wash? Come on. We have great cleansers that are safe for your skin, great products that improve the health of your skin as well as the beauty. And that's the thing I preach a lot about, health and beauty. And I think you can care for your skin in a very careful way, not overdo it, that does make the skin healthy. And
Agreed.
I think it's not complete ignoring it. It's like with the preteens that come in, they're starting to get acne. We're trying to introduce to them how they get used to skincare. We start with a simple routine, maybe a skin cleansing pad. But never do I tell a mom, don't worry about it. I don't have to do anything. It's all good. It's fine. Do you?
You know, I don't say don't do anything, but I do think for my young patients, I encourage them to do very little. Yes.
Just wash and move on.
Yes. Wash with a
Sunscreen.
gentle cleanser, maybe a moisturizer with a built-in SPF, just so it's a single product for the morning time. But yeah, you're right. I would rather somebody almost do less than too much. I think one thing to keep in mind when you're looking at social media is that these people are performers. They're influencers. They get paid by driving views to their page. And so the more sensational their post, the more, jaw-dropping things that they're doing, the more that helps their personal business. So I don't blame anybody, but I think it's just important to keep that in mind when you're watching these influencers.
Well, maybe the caveman is some guy or a bunch of guys that saw their significant other, their girlfriend, take over the whole bathroom counter.
Oh, yeah. And now they just don't have any counter
her
space.
ring light and all her products and her camera. And he's like, God, I'm just trying to get in here to brush my teeth. He goes, all right, that's it. I'm caveman-ing it. But maybe a sub-caveman, simple but enough. Is the message here. Keep your skin clean and healthy. Wear sunscreen. And we can guide you in more complex regimens if you need. Caveman trend?
Down.
Might even be a two thumbs. It might even be a two thumbs.
And speaking of the caveman trend where we don't do anything for our face, I feel like there is a lot of information out there about the scalp. So people are talking about the scalp in a very similar way as their skin. So the scalp is skin. And I think that concept is catching on and is kind of a trendy thing on social media these days. So where do you stand on that? Are you more caveman, let's do less for our scalp, or do you think we need a routine?
I think you need a routine on your scalp. I do. This trend, I think it started actually in 2021 of not shampooing. And I was seeing young men come in with scalp issues, scalp buildup, scalp itch, flake, even bumps, greasy hair. They let their hair grow over their face, acne. But honestly, sometimes they were just coming in for skin checks, and I noticed the gross hair, and I was like, "What how often do you shampoo?" "Oh, I don't like to use shampoo. I heard you weren't supposed to."
The no-poo.
The no-poo. My message is usually pretty short and sweet. I think you need to shampoo. I think you need to keep your scalp clean. If they're single men, I tell them how important I think this is for, dating and looking nice and having a healthy look to you. So I'm not in favor. If you have dry hair, Dr. McLean and I both will recommend minimizing shampoo, maybe even a occasional use of a sulfate shampoo, which is also a trend, sulfate-free shampoo. If you have dry hair and you like a sulfate-free shampoo, I even advise you, use a regular shampoo once in a while you need those surfactants to clean the dirt and the oil off your scalp and hair. the idea of over shampooing is it cleans it too well.
So I think what you're getting at is not everyone necessarily needs the same hair care routine.
Correct.
But it is important, at least every now and then, to wash your hair. How often do you like to wash your hair?
I hate washing my hair because it's so much trouble. But I wash it 2 or 3 times a week. and
Same for
I
me.
feel like I really need it the day before my shampoo. So I'm not skipping it because I think it's going to make my hair look bad. I just don't have time to go through the hair drying cycle. Many women can relate to that.
Yes.
I think it's also trendy scalp treatments, and I do recommend some take-home products for scalp treatments occasionally, exfoliating scalp treatments, scalp oils. As you get older, a lot of our older women have dry scalp. There are treatments for the scalp, like hydrofacial for the scalp. We offer that here. I think it's most helpful. What I typically see it in is afro curly hair, where it's actually harder to get in and clean the scalp, and they don't shampoo as frequently. If you have a lot of buildup of scalp, I've actually seen it cause hair loss and breakage. I'm sure you have too. And so that's an option. What else? Have you seen anything else on social media about scalp treatments?
Absolutely. Have you heard of head spas?
Oh, a head spa.
head-
It sounds nice. I would prefer a massage, I think.
Yeah, I think we all have our things that we like when we go to the spa. I actually have not tried a head spa, but a head spa is a facility where they do spa treatments, wash your hair. I want to try it. So anybody out there, I'll take a free treatment. But yeah, so people are actually going to these places and spending an hour having somebody massage their hair, wash it. They have different temperatures of water, different products. So yes, people are really investing into their scalps.
It can be nice, I think, to get a scalp massage.
Absolutely. A lot of times on my
More
skin
for
checks,
musculoskeletal, I think.
but it also just feels good. I mean, when I'm doing my skin exams and looking through the scalp, a lot of times people are like, oh, I wish you could just do that all day. Because it just feels good to have somebody
does.
gently play with your hair.
does.
So, why not?
So maybe we haven't personally experienced scalp spas, but I would say, based on our conversation, they're a thumbs up
For relaxation.
for relaxation.
Yes.
And then I think what's also a thumbs up is appropriate hair care and scalp care for your skin type, your level of oiliness. Other skin conditions might play a role.
And I think if you're having a hard time figuring out what your sweet spot is, that's something that we address in clinic with our patients all the time. So if you're struggling with dandruff or dry scalp or hair loss, how often to wash your hair, how to maintain a good, healthy skincare routine is part of our evaluation.
Absolutely. You know, another trend is that I've seen, I didn't know what it was, skin slugging.
Oh, yeah.
And I laugh about this one because I'm like, oh, Lord, I've been recommending this for 25 years. I call it soak and grease. If any of my patients are listening that have been with me for a long time, they're like, oh, yeah, Dr. Roston tells me to grease up my skin while it's still damp when I get out of the shower. If you have dry skin on your face or dry lips, I'm like, look, use some spring water, pat your skin with water, and then put some grease on it. I don't know if you actually need to slug it with a thick layer. You can, but there's some nice benefits from a lighter grease like the Elta Intense Moisturizer that soaks in very well. Do you recommend it for eczema and dry skin?
In residency, I will never forget. I mean, week 1 of residency, our pediatric dermatologist attending came in and talked to us just about basic skincare. And we had a whole table full of different products, just basic stuff, Aquaphor, Vaseline. She even had a big tub of Crisco, which is a very cost-effective moisturizer, if you're
Yes, it
wondering.
is. Preservative-free.
Yes. We don't really recommend that often
Not
in this
that
clinic,
often.
but it's out there. Anyway, so one of the very first things I learned about in residency was the importance of moisturizing your skin and to think of moisturizer as medicine. I was also trained to avoid the word grease just because I think that has a lot of negative connotations. So I personally do not say grease. But yes, the concept is there. I also don't really talk about slugging. I think it's just all different words for the same thing.
Yeah.
The idea is that you put a thicker occlusive layer to lock in your moisture and any underlying skincare products. So I do like that. A question I get asked quite often, especially from acne patients, is if the more occlusive, greasy ointments are going to make their acne worse. And I think it's an interesting one because actually petroleum jelly is non-comedogenic.
Yeah, it's very surprising to many patients
Yes.
that they can put Vaseline on their skin quite safely without causing problems with acne. If you keep it thickly occluded for a long time, you
Yes.
might get some occlusion bumps and things like that, but it's not
Yep.
truly, the word medically is comedogenic or
Correct.
acnegenic.
Yep. So when I'm recommending people put on something like that, if they're slugging or soaking and greasing, I recommend that they warm up their ointment on the fingertips first, so it goes on more as a light oil, and then it'll soak in, and you get the sweet spot of the right amount without overdoing it and getting too thick of a layer.
Yeah, I think it's a great. I do
So
it.
pro
I do it.
slugging, I guess. We just don't always call it that.
I'm pro slugging. I do it every time I get out of the shower. My dog Daisy, she knows. She can hear the lid of my greasy moisturizer opening in the shower, and whoop, she comes by the shower door because she likes to lick it.
Oh,
It's definitely a healthy skin trend. And
And a healthy
skin
dog treat.
slugging is nothing new. You can see that I've been doing it since the dark age, and even the younger generation is
yeah,
doing
we love it. I don't necessarily do it every day, though. I think that your skin is an organ. It changes. So the way I care for my skin in the winter is very different than the way I care for my skin in the summer. So I may not need as much of that occlusion and the soak and grease or the slugging in the summer. So it's okay to vary your skincare based on how your skin feels on any given day.
Absolutely. I think I get asked every day about red light therapy. And I do recommend red light therapy routinely for enhancing hair growth, increasing skin thickness. There is a particular combination light cap that we recommend. It's app-driven. It's called Revian. It has red and orange light. Some new evidence with Revian is that it actually inhibits the activity of 5-alpha reductase in the scalp, and that's the hormone that causes pattern thinning, particularly in men, but also women. I use that red light every day to keep my hair thick and full. But I also get questions about red light for the face. And there's a new mask that is very popular. I'm forgetting the name of that mask, where you wear it. I don't think that one must be very intense because it's cheap. I shouldn't say cheap. It's inexpensive, and the lights are just held so close to your face. I can't quite imagine wearing that mask. But let me start by saying red light is legitimate. This is photobiomodulation. There's a whole field on it. During COVID, a very well-controlled study was done in the ICU on gravely ill patients. And if you recall, the physicians didn't know how to save these people. They were trying everything. And so a group of patients was randomized to a red light therapy on their lungs, each side, 10 minutes a day. And they did so statistically better than the control group, which had no red light. It was astonishing. So you look at like a 0.001 as being important. This was like 0.0000001% effective. It can be used on joints, tendon and ligament healing. It can be used also for rejuvenation, control inflammation. It can be used for acne. We have a blue light. We have a red light here. We do not use it that much because it's a big wraparound, but we definitely have it here. What's popular now is home red light. I will say about red light and the photobiomodulation, I need to take a deep dive. I don't know a whole lot. I went to a whole session at the American Society of Laser Medicine Surgery meeting, and it was fascinating. I bought a red light for my father for his lungs because he has restrictive lung disease, and it's helped him. But it's kind of like a lot of things in life. Too much of a good thing is too much. So I absolutely do not recommend red light rooms or full body all the time. There is definitely evidence that too much red light, it just shuts your body's response off. Your body says, well, this is too much. We're trying to elicit a response, not shut one off. Have your patients been asking about red light?
Oh, every day. And there are a lot of different brands of these masks, and some are better than others. Some have only red light. Some are red and blue. Some even
Green for anti-inflammatory.
Yep. So there's a whole mix of things. Some have kind of a rim right around the eyes, so your eyes are protected really well. So I definitely get asked all the time. I agree with you. I think the science is sound here. We've been using light in different ways in the field of dermatology for good for decades, all the way from UV light, narrowband UV therapy that is still an effective, although less commonly used treatment now for psoriasis, eczema, vitiligo, all that, to red light that, like Dr. Austin mentioned, we have a huge, very powerful red light here that we mainly use for precancers and sometimes superficial skin cancers. So the science is sound. But when people ask me, should they get one, it's a little more nuanced. The studies for red light on the face for anti-aging purposes are done with 10 minutes a day, at least 5 days a week for 30 plus weeks all in a row. And for most patients, I think that's a regimen that's quite difficult to maintain. So I always tell my patients, know thyself. If you're going to invest $500, $1,000, whatever the price may be on one of these masks, you probably want to make sure that you can actually do that as part of your day-to-day routine. And a lot of patients, when they really think about it, they say, oh, actually, I thought I could just do it here and there and get the benefits. And so, it's more nuanced. But if you can be consistent, then sure, absolutely, knock yourself out. The one thing I would not recommend are the red light wands. So there's some wands, and I think they're marketed because they're smaller, they're more affordable. They're still the good red light, but you're just not going to get enough of a dose if you're just kind of swiping it over your face like that. That I'm a little bit more skeptical about. I think if you're going to invest, just get the full face mask and really commit to using it every single day.
Yeah, I agree. When I counsel patients about the hair loss, and I do it, you put it on your head, and I make coffee and get the dog's food ready and everything. It's app driven, but I have a conversation with them like, don't do this if you're not going to be committed or you think you can't get in the habit. Or sometimes if you travel for work, I do have gentlemen that pack it in their suitcase, but I think most women don't have room in their carry-on for a little cap that they wear. I have bought a red light actually for my horse who has chronic back issues. And you're exactly right. It needs to be 10 minutes a day. Everybody thinks you can just do it periodically. I think that he can get some benefit. Maybe he can when I go out there and put it on his back. But I try to get someone at the barn, put it on him while he's eating. The one mask that I thought about buying for myself is the Saluma, because it's kind of shaped around, and I think that's a more appropriate distance away from, but I may have to look at some of these fancy masks. But am I going to actually lie still for 10 minutes with this thing? My lifestyle, the answer is no. I'm just not. I can walk around with a cap on my head, so I haven't made that investment, but maybe I can look into some more advanced masks. I'd probably scare the dogs wearing the mask around the house.
There's a lot of really funny social media posts about people wearing their masks and scaring their pets and children and
But
such.
there's all kinds of red lights. I mean, I think the name of the company I bought for my horse is Photo Health or Photonic Health. I mean, you can use it on you. It's a pad you can wrap around. Lower back pain, healing from surgery, elbow, wrist, but it does need to be consistent. So I would say, yes, you can look into it. For anti-aging and treating your face, it just might be challenging. It's one thing to sit and watch a TV program with a red light blanket on your elbow, and it's a whole nother thing to sit still and you can't read anything and you can't drink anything. I find that hard. It just may be my personality. I think it's
Mine too.
I can't sit still.
Yes.
So I think in general, I might even give red light 2 thumbs up. You just got to get it to match your lifestyle, to match what you're treating, to get the appropriate device. If you want one for acne, it's blue. Healing and regenerative is red. Anti-inflammatory, they say green, but red has some anti-inflammatory. It just all needs to come together like a puzzle.
Absolutely. I agree. 2 thumbs up for me. However, if you know thyself and you're not going to be able to be consistent, take that money and invest in a laser treatment instead.
There you go.
That's what I tell my patients.
So another trend that was pointed out to me was was mouth taping. And what I said was, no, that's for breathing. Because there's a book called Breath by James Nestor. One of my patients loved it and recommended it. I have not read it. I kind of thought nothing else about it until another patient came in and she says, I'm trying to learn how to nose breathe by taping my mouth. And she said it came from this book and she was really enjoying it. So I thought that was the only thing about it. But apparently the use of mouth taping has been extended to purport anti-aging benefits around the mouth. What have you found out about mouth taping?
Well, I had never heard of this trend. I had never heard of this trend. I had to look it up.
Yeah, me too.
And so I see that they have these, commercially available tapes that are shaped as your mouth, that go around your mouth with a little hole for air, I guess, that are supposed to reroute your breathing overnight through your nose. And I guess there's...
Well, the breathing tapes, some tape over your lips with no hole. It's really astonishing. Or they just have one vertical piece. But yeah, this has been translated into tape for the lip. To me, when you use tape, you're trying to immobilize something. Well, you're obviously trying to tape something, but, immobilize it. But your lips aren't moving while you're sleeping. I mean, they might a little bit in REM sleep or whatever, deep sleep. But we get wrinkles on our lips from talking to each other and sipping our coffee and smiling and laughing and kissing and all that stuff, not from sleeping and dead silence. But what are the beauty benefits they purport?
I have no idea.
I think this will be short and sweet.
I mean, truly, okay, I had to look it up. Okay, so this is what the internet tells me, that you may have better sleep, which equals better skin repair. Okay, I do think sleep is important for healing and regeneration.
Decrease cortisol,
for your
stress.
whole body, including the skin, sure. So we want better sleep. I'm not sure any studies exist showing that mouth taping actually leads to better sleep, but I am all about good sleep. Nasal breathing leads to less water loss overnight. Okay. And no more dry, flaky lips or perioral irritation. I actually...
That was my
BS
concern, was
on that.
irritation galore.
Absolutely
This is going to be the next deodorant rage. You're going to be seeing all these rashes. Has anyone had a Band-Aid dermatitis? Really?
Yeah.
Or hurt when you pull the Band-Aid off? I'm sure these are more gentle than a Band-Aid, but still, I just thought immediately irritation. First of all, when you tape strip, you're pulling a little bit of that skin off, so you're going to be more prone to sunburn. But also products you don't normally react to or get irritation from, Shazam, now you suddenly are because you've pulled that upper layer of skin off.
And the internet also tells me that it's meant to reduce drooling. Which...
See, I think this is kind of fun just from a comedic standpoint. But I think it's pretty easy for us to give it a thumbs down.
Yep.
I don't even see any potential for this in the future. So shall we? Thumbs down.
And
there we
certainly
go.
even maybe risky if you're dealing with sleep apnea or anything like that, which is super common. So
Yes.
absolutely 2 thumbs down.
2 thumbs down. But I can't wait to figure out how we're going to treat all the dermatitis coming in from this.
We've got options.
Yes.
Thank you so much for tuning in as Dr. Austin and I did a little deep dive on recent social media viral trends about skincare. Hopefully you had a laugh and learned something. If you'd like to follow us on social media at Charlotte Skin and Laser or at Dr. Emily McLean, we do post and try to keep things informative and evidence-based for you. Thanks again. Thanks for listening to Queen City Skin with Dr. Elizabeth Roston and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.